And speaking of Medicare experts, we have one right here. This is Chris Goodwin, president of Insurance Pros, joining us now to clear up any Medicare misconceptions. Now, already between the show here, I was asking questions because I have a hard time distinguishing different healthcare questions. But first off, what's important about this time of year, concerning Medicare?
This time of year is referred to as Medicare's annual enrollment period, or AEP, and that goes from October 15th through December 7th. So this is the time
this is the last week then?
Yeah, this is the home stretch. So this is the time when anyone who's already on Medicare can evaluate their Medicare Advantage plans or their prescription drug plans, and they can shop the market on a guaranteed issue basis. No underwriting involved, and if they can find a plan that best suits them for 2019, they can buy it.
Okay.
So very important to get it done, because if you call on the 8th of December,
you're out of luck.
Then you're out of luck. Yeah, so you're locked in for the next year on what you have.
So already. It's not too late now. So just make sure you get that call in. Preferably call one of our folks here today, who again are taking your calls till 8 o'clock tonight, and kind of get that ball rolling so you can get that done before Friday. But what's new and that people need to know about for Medicare this year? What are there any changes that people should know about?
Yeah, there's some small underlying changes in the deductibles with Medicare A and B, and some people already learned that Part B of Medicare went up $1.50 for next year. But what's really important is that many of the Medicare Advantage plans have changed quite a bit. The prescription drug plans have changed quite a bit, so that there are some new competitors in the market that actually might make for more competitive pricing for some people.
Oh, that's good.
Yes, and some of the insurance carriers have come up with new revised plans that add new benefits, like comprehensive dental coverage with your Medicare plan. Also, non-emergency transportation, over-the-counter allowances, and just different things. So it really pays to take a look at what your company has done and what is out there when it comes to Medicare.
And speaking of that, just how important do you think it is for these Medicare plans to now have the dental, and is there any vision care available through these plans as well?
Yes, as a matter of fact, there's vision on a lot of different plans, so you definitely have to check your plan and others, and they've even added a lot of lens and frame allowances. These things can be highly important because of people's budgets, and if you could get all of that in a one plan, then it could be meaningful.
Yeah. And what's the best way to go about to find out more about these changes and to get these plans that best fit you?
Right. Well, at this late stage, I think the best thing to do would be to consult with an independent broker, somebody who has knowledge of all of the different plans, which is why it's so meaningful that Aetna Coventry is partnered with a lot of independent brokers who are here today, and they're able to just actually give you a wide range of knowledge, and you don't have to go from company to company trying to figure something out if you have somebody who actually handles all of it.
Well, you know what, to me at least, it's a very confusing topic with just so many options and different things available. So we really appreciate you spending your time here with us today and for helping to answer some of those questions that people might have. And today you can call in for healthcare in the Heartland until 8 o'clock tonight. Get all your questions answered by independent agents, and the information is right there on your screen.